Well, welcome all. My name is Christopher Bennett, and I'm the board chairman for Tsiouris Community Development Corporation, a para nonprofit organization for Trinity Baptist Church in Hackensack, New Jersey. We're delighted to have you here and welcome to Community and COVID-19, a discussion about vaccinations. Before we begin, I'd like to just thank a few people. First, thank you for coming. I'd also like to thank the Tsiouris Community Development Corp Board of Trustees, Pastor George Mays IV, Trinity Baptist Church, as well as Community Baptist Church, Valley Hospital for their willingness to lend us some of their greatest physicians. Also Elizabeth Lucas, Community Development there at Valley, as well as Doctors Williams, McGugins-Hill, Pinto, Moise, and Thesaurus for their unwavering commitment to our community. A little bit about Tsiouris, some things you should know is that Tsiouris Community Development was founded in 2001, again, as a para nonprofit organization for Trinity Baptist Church. Our main concerns and focus are in a few areas: health and nutrition and food resources, as well as education and economic development. So if you have any questions or want to know further information, please give us a call. We're located at 218 Passaic Street in Hackensack, and our number is 201-487-3656. So without further ado, let's get started with this wonderful discussion. Dr. Williams?
Thank you. Really great to see all you come out to hear something that I think is very relevant and important for us today, especially on such a beautiful day, Sunday, and it's so bright outside. For you to take the time to do this, we really just want to thank you. The format today is I have a few introductory remarks. I would like to have each of the town hall participants also introduce themselves, and they will talk about whether they've gotten the vaccine and how they decided to get it, what prompted them to get it. And then we'll have Dr. Thesaurus, who has an infectious disease background, just share a little bit about perspective about what vaccines are about and how they work or where the status is. And then there's some questions that we received from you that we will try to answer as many as we can. We may not get to every one of those questions, but you certainly can also, we'll have a link to send some further questions if you have want to reach out to us that maybe we can answer by email. So we live in an amazing, diverse community in Bergen County near New York City. But we also know racism and white supremacy is still causing untold damage. The pandemic tells us that injustice because of race is real. It has shown us through our stats the inequity in healthcare. So that's part of why we're here today. I just want to encourage you, for you and for your family, and perhaps some of you already have gotten the vaccine, but maybe you're here so you can help other people in your community. I think the key term here, phrase, is wisdom versus fear. Making a decision based on wisdom versus fear. How do you decide about a new healthcare breakthrough? Is that something for you or not? And especially, unfortunately, in the context of a climate or a culture or a history where there has been unequal healthcare. I would just say a couple of things to start. First, we know that the technology for this vaccine has been developing for over 15 to 20 years. It is not new. Yes, there was a rapid development in the last year specifically for COVID-19, but it didn't just happen somehow magically. This has been worked on for a long time with the SARS virus, which is a cousin of COVID, even other viruses. If you remember, President Obama started a task force that focused with the Ebola virus on virus therapy. So this is not something that just somehow was magically came out. We also know, as far as clinical trials go, that the Pfizer and Moderna trials in particular had about 9 to 10% of the population was Black out of 30,000 patients, 35 in each arm that was, each study that was looked at. And just so you know, we participate in a lot of clinical trials, and generally most of those clinical trials, you're fortunate if you have 1 to 2% people of color. So though the numbers are not quite that of the United States, they are definitely much more robust than usual. There are about 20 to 30% of the population was Latino or Hispanic in these trials. So you were, depending on your color or race or ethnicity, was represented in these clinical trials. We also know that the short-term efficacy and safety is high for all vaccines. What we don't know is how long the protection lasts. We are learning more about variant strains, and there's still questions about responses in the immune compromise, but we can talk some about that. So how does one decide? You weigh the risk versus the benefit, but the way you do that is you start, if you are not a medical expert, my encouragement to you is to get a trusted person, but someone who is knowledgeable, which typically is someone in healthcare field, who can help you navigate this. There's a lot of information on the internet and texting and otherwise you can get. There's a lot of information all over the place and crazy things that are out there. How can you sort through all that? You really need somebody that's trustworthy, who is knowledgeable. Secondly, take the emotion out of it. Look at the information to make sense of it. One of the challenges of racism is it victimizes us. And when we're victimized, it creates fear. And history teaches us that when men and women base their decision based on fear and emotion, often those decisions are not good decisions. They can be very destructive. So even though there's been an injustice and unfairness that's occurred, unfortunately, because of fear, we may perpetuate, continue poor outcomes because of our own fears created by an unfortunate and tragic injustice that occur. So you really want to try to base this on that. So for me, why did I get the vaccine? I looked at the information, I looked and understood it and trusted it. And then I wanted to protect my health, my family's health, my community's health. And finally, I'm a grandfather. I wanted to hug my granddaughter. And I wanted to be able to connect again. And so for all those reasons, both based on science and personal, that was my decision. So I'm going to now open it up and have Dr. McGugins-Hill and Dr. Thesaurus also share why they got the vaccine and who they are. Maybe they can share a little bit about who they are as well. Maybe start with Jennifer.
Hi, everyone. Thank you so much for joining us on this beautiful Sunday. It's definitely a privilege and honor to participate in this, this program. So my name's Dr. Jennifer McGugins-Hill. I am a primary care internal medicine provider in New Jersey with Valley. My office is in Park Ridge. I'm the medical director there in Park Ridge, New Jersey. And yes, I did receive the COVID vaccine. I received the Moderna vaccine, which is, two dosages. It was definitely a no-brainer for me to receive the vaccine, not just because I'm a medical provider and I see patients, but more importantly, I'm a mother, a wife, a daughter, a niece, an aunt. And, there's a responsibility that I felt to my family, to myself and my community to be protected, to protect myself, to stay healthy, but also to protect others by preventing spread of the disease, and an awful disease at that that's caused 500,000 deaths nearly. So it was definitely a no-brainer for me to get the vaccination.
Okay. Simon. Yeah.
Hi, and thank you for inviting me to participate in this. My name is Simon Churris. I'm an infectious disease specialist. Been working in New Jersey for the last 8 years at Ridgewood Infectious Diseases, which is symbiotically tied to the Valley Health System for probably the last 30 years or so. And I got the vaccine, because I was going to be seeing patients who were going to have COVID, and I wanted to make sure I protected myself, but more so to protect my family, like everyone else has been mentioning. I have 2 elderly parents who live in the same town as I do. We see them often. They're not in the best of health. I wanted to make sure that I could do what I could to keep them safe. They've been vaccinated. My wife's been vaccinated, and last week our 13-year-old son got his first dose of the Pfizer vaccine, and I received the Pfizer vaccine back in December.
Right, great, thank you. So, we're here hopefully to be able to answer some questions and hopefully build some trust in what this is about. So, I'm going to actually ask Dr. Thesaurus to just speak just briefly about what are vaccines, how do they work, how, just what is that process? There were questions related to that, and perhaps you could just give a brief synopsis. Can we trust the process? Can we trust these vaccines? How does it work? Are we getting injected with radioactive isotopes or computer chips, or other devices, the way these were developed, that we should be concerned about?
Sure. So just to give us a little bit of a background, in the state of New Jersey, there's about a total population of about 9.3 million people, of whom over the course of the pandemic, about 880,000 have had COVID. And there have been a total of 23,400 fatalities since the pandemic began. Since the vaccines have become available, there have been 8,270,000 doses administered in the state of New Jersey, which amounts to almost 4 million New Jerseyans having been fully vaccinated against COVID at this point. As Dr. Williams mentioned, there's disparities about who's been getting it, who's been vaccinated, but the state has been making great progress in that. And over the course of these 8 million and change doses in the state of New Jersey, over 200 million doses nationwide, the evidence is that these are exceedingly safe vaccines with very, very low side effect and adverse event rates, ranging in the 0.001%, 1 out of 1,000, or sorry, 1 out of 10,000 people having any kind of a serious adverse event. So they're very, very safe, especially compared to other vaccines that we all sort of take for granted at this point. I wouldn't have, vaccinated my family or myself if I thought this was something to worry about. The vaccines, I think, one of the questions was, how was this created so quickly? How did this vaccine go from an idea to in people's arms in less than a year? And I think part of that is just the amazing system of research development and scientific endeavor that this country has in general. But it's not just that. The idea of using mRNA, and I'll talk about what exactly that is in a minute, but the idea of using mRNA to help treat or prevent diseases is not a new idea. It's been something that different companies here in the US and abroad have been working on for over a decade. So the technology wasn't sort of a brand new idea that came out last spring. It was something that has been in the works and found its life-saving role in the last year. The company that Pfizer is working with, which is a German company, had been developing mRNA technologies for over a decade, trying to work on cancer treatments. Moderna, which is a Boston-based company, which teamed up with the NIH, had been working on similar kinds of therapies. And so there was already work being done in humans. And they applied it to this. And I think that the most important thing from a scientific perspective, I think, for everyone to understand, is that whenever we look at anything that comes out that's new, that's research, and looks like it's amazing or wonderful, the first question everyone as a scientist should ask is, well, can it be reproduced? Can you do it again? Or can someone else take what you just did and do it again? And we have that proof because the Pfizer and the Moderna vaccines are very similar, but they were created independently by 2 different groups and they came out with almost exactly the same results in terms of how effective and safe these vaccines are. The way the vaccines work is that basically we know all of the genetic code of this virus. We took a piece of that code and turned it into mRNA, which is kind of like saying if your DNA is your blueprint that makes you you, mRNA is a working copy of that blueprint. So we took one small piece of the virus's blueprint, which is the piece that gives the instructions for making the spike protein. If you've seen pictures of the virus, it's a round ball and it's got these little red things in all the cartoons you've seen of it sticking out on the surface. Those are the spike proteins. That's what your immune system makes antibodies to stick to the virus and eliminate the virus. The mRNA vaccines work by taking the code, making the copy, putting that inside of us, and letting our own bodies basically make just that little spike protein. When our bodies see that spike protein, the immune system responds, creates antibodies, so that if we ever are exposed to the actual virus itself, we're already primed to defend ourselves. We don't have to play catch up trying to respond to it. Our body thinks it already has seen this and just takes care of it and clears it out of our system. And in not just the trials, but now in all these hundreds of millions of people who've been vaccinated, they've looked at how is it doing in the real world. And in the real world, even in the most risky settings, like the healthcare settings that people on this call are working in, where your risk of exposure is the highest, the vaccines are performing almost exactly as they did in the trials, over 90% prevention of illness and 100% prevention of severe illness and death. So really remarkable. And in terms of its effectiveness in the real world, really remarkable in terms of its safety, both in the trials and the real world. And I actually do believe this is not just a breakthrough in terms of healthcare for this virus, this pandemic, but this is going to change how we might approach vaccine developments and treatments for many other things in the future. And I think it's a very exciting time in terms of that respect. And I'll pause there.
Simon, can you also just briefly talk about the J&J virus? How does that differ from the mRNA viruses that you just spoke of?
Sure. So Johnson & Johnson, with its company Janssen, made a vaccine as well that works a bit differently. So what they did was they took a different virus completely unrelated to the coronavirus called adenovirus, which typically causes like a cold basically in most people. They kind of dumbed that adenovirus down so it's pretty weak, can't really cause illness in human beings anymore. And they stuck inside of that virus essentially the same genetic code that the mRNA vaccines are using too, the code for the spike protein that's on the outside of the coronavirus. So essentially the way this works is it's a virus gets injected inside of you, your cells take up the virus inside of them as they try to just attack and clear out this adenovirus. You don't get sick from the adenovirus, but once your cells take up and sort of engulf the adenovirus breaks apart, the piece of instruction slips out, and essentially the same thing happens. Your body takes that piece of instruction, makes the spike protein, your body's immune system reacts to the spike protein, and now you're primed to defend yourself in case you're actually exposed to the coronavirus. And the AstraZeneca vaccine that you've heard about that's been used more in Europe and hasn't been authorized here in the US yet takes a similar approach and has almost as good efficacy in the trials as the Pfizer and Moderna vaccines. It seems to have a lower chance of completely preventing any illness, but the people who got the vaccine who did actually get infected and sick had very mild illness and did very well. And again, its effectiveness at reducing hospitalization and death was as good as the other vaccines.
Thank you. So let me ask this question to both you guys. What are the potential long-term effects of the vaccine?
Yes, so that, there are some areas where, more research is, underway. And so we don't 100% know that as of yet. But, we're already seeing more potential long-term effects of having had the disease itself. So really kind of encouraging folks from a preventative standpoint from getting, COVID virus itself by getting vaccinated, seems to outweigh the concern about long-term effects of the vaccine that we really just don't know yet. Yeah.
Jennifer, did you have any side effects when you got your shot? Is there any things you experienced that people should just be aware
Sure.
of and what to do if you
Sure.
have?
So the typical, side effects more so after the second inoculation, were, body aches, chills, fever, fatigue, pretty much did not last more than, I would say, 24 hours. And that's been typical, 1 to 3 days where, we kind of anticipate having certain symptoms, even really less. And I actually worked that day, the day that I got the second vaccine. So, I mean, definitely tolerable. If you have the ability to take off the day of the second vaccine, that's great. But it was very clear that was something that I was willing to go through as opposed to actually getting, COVID itself.
Yeah. I think the one thing that sometimes my patients are surprised at is when you reproduce the spike protein, you're actually producing an inflammatory response as if you were infected. So you are not infected. Let me stress, this is not a virus, but the protein that's released will mimic the virus. So many people who get the shot will be somewhat frightened by the fact that they get similar symptoms to COVID, but they are milder, they don't last for the vast majority of people, and they really do clear up. So just as a point. So I would like to ask both of you, there was a lot of information pressed on the J&J recently because of some clotting issues that occurred. So how do you advise patients or your family in relation to choosing vaccines in the J&J, and what is your thinking on that? And I'd like both of you to answer. One of you can go first, but.
So yes, so that definitely has been a very important issue that's come up on, in a primary care setting. Basically within the age group of 18 to 49, I believe it was, you're talking about 7 cases in, a large group of vaccinated people, very small amount, and associated with thrombocytopenia, which is basically a low platelet count, perhaps someone that had a predisposition of a low platelet count. It mimicked syndromes of folks that had a propensity for a low platelet count. The safety profile is still there. I do still offer it as an option for patients, but if perhaps they have a predisposition for some type of clotting syndrome, then I'll recommend either Pfizer or Moderna.
Okay.
Yeah, and I'll echo that. I think it is still an exceedingly safe vaccine. It's been very few cases. It's not 100% clear if it's really there's a cause and effect there, or if this is an association we're picking up because everyone getting these vaccines is being watched so carefully, and everything, whether it's a rash or a blood clot or a headache or just feeling funny is being reported. More so than any other vaccine in the history of vaccines, actually. I mean, I think this is probably one of the biggest endeavors when it comes to following what happens with these new vaccines that's ever been accomplished in modern medicine. I still have no qualms about recommending the Johnson & Johnson vaccine. I think there are some people who are actually allergic to polyethylene glycol, which is a component of the Pfizer and the Moderna vaccine, which would mean that they could not get either one of those 2 vaccines, and they could only get the J&J vaccine. And because it's only 1 dose, for certain populations, it's a really great choice to have available. Homebound populations, people who have difficulty with mobility or transportation, people with special needs, adults and children. It's not approved for children yet, but when it will be. it's nice to have the option. I'm glad they've reauthorized it after that pause. We have at Valley, we are still using it at Valley in certain situations. We're giving much more Pfizer and Moderna, but that's mostly because of supply, not because of feeling that one of these vaccines is better than the other.
Yeah, thank you. So many of you may be wondering, well, do I have allergies I should be concerned about, or do I have clotting issues? So my recommendation for you is, if you have questions, this is where you go to your physician and have a discussion. But the discussion is not whether to get the vaccine. The discussion might be is what's the best vaccine for you, or which is safest for you based on your particular health profile. There was a question that was asked is, do vaccines work effectively for people who are immune compromised? And should these patients always remain masked even if they do get the vaccine?
That's a great question. So that, and Dr. Williams, you alluded to that in the very beginning, that there's more data is required and being researched for those that are immunocompromised and that are potentially on immunosuppressant agents. And the CDC, that they have defined what immunocompromised basically they consider to be. So those that are HIV positive with low CD4 counts, those that are on high dose steroids for over a couple of weeks, or have other kind of immune deficiency disorders. And we don't know 100% regarding the efficacy, but it is still advised to get the vaccine, because the potential for more serious outcomes for this patient population being infected by COVID, the COVID-19 virus, is pretty significant. It's pretty significant. So, the potential risk or lack of efficacy that we still don't really know yet with that population getting vaccinated doesn't, it's not outweighed by the severity of the disease if they get infected. So we definitely still are encouraging vaccination.
Okay. Simon, you agree, or you have anything to add?
No, I agree completely. I think there's a lot of people looking into what how well these vaccines work in people who are immune compromised, and saying someone's immune compromised is there's various types of immune compromise, various degrees of immune compromise. They're definitely safe in these populations. How effective they are might vary, and we'll probably know more about that as time goes on. People who are immune compromised obviously are higher risk of getting sicker, so they should get the vaccine. Taking extra precautions is not a bad idea. So we know more about which groups respond well to these vaccines and which respond as well. And then the next step is going to be these companies will be trying to adapt their vaccines to be more effective in people who are immune compromised. That will come with time as well.
Right. And the other thing I just thought about to think about too is, with, whenever we talk about vaccination in immunocompromised patients, this is, Pfizer and Moderna is messenger RNA. So, the science behind it has been around for, late 1990s. And it's a very crafty, smart science, but it's not a live vaccine. So we tend to get more concerned about vaccinating an immunocompromised population with live vaccines. And this is not a live vaccine. So that really kind of tips the scale more to a safety profile in this patient population.
All right, so immune compromised should consider getting the vaccine, but given the fact their response may not be as robust, it's probably important that they continue to wear a mask and social distance, be more cautious, maybe more cautious even than the average person in terms of that.
Correct.
I see Dr. Moise joined us. So
hi, everybody.
Hey, could you just very briefly, we've all done it, but could you just kind of introduce yourself, your background, and did you get the vaccine, and how did you decide to get it if you did? What was your thinking behind it?
Absolutely. So I'm Gaetan Moise. I'm one of the neurosurgeons over at Valley Hospital. I definitely got the vaccine pretty much as soon as it was available. So the first one that was available was Pfizer, which you guys have already heard about a little bit. And I kind of jumped at the opportunity. Since then, you know, I have a pretty big household. I have 4 kids, and my mom lives with me, and she's, you know, older. So she herself got the vaccine once Valley made it available. My wife, who's a nurse, also got the vaccine, and then 2 of my children qualify because they're over the age of 16 first, and so she got both of her shots, and then my 12-year-old son just got his first shot of the Pfizer, which has been recently approved. And, you know, we've had sort of a span of reactions. My mom and I basically had no reaction whatsoever, other than a little bit of a sore arm. My daughter felt, you know, fine with the first injection, and then the second one, you know, for about 12 hours, she kind of felt a little bit under the weather, but she's doing school from home, and so she still participated, and she was fine by the end of the day. And my wife was probably hit the worst in terms of symptoms, felt great after the first, and she had the Moderna. And then the second one, you know, basically for 24 hours, you know, she looked like she was ill. She had a fever, a little bit of chills, you know, some muscle aches. And then the following day, it looked like she wasn't even, you know, ill at all. And I think, you know, you kind of see that in the data as well. You know, one of the reasons why I was very eager to get the vaccine and also make sure that everybody in my family did is because that's really the way I feel that we get out of this and we get to normalcy is, you know, everybody getting vaccinated so that the transmission of this stops, you know, prevents us from seeing variants coming up in the wild that potentially could affect people who are at more risk than myself. And then the other thing, just jumping off what Dr. McGugins and Dr. Tsiouris had mentioned is, you know, the technology here is new in the sense that this is the first time that they've produced a vaccine that's doing this. But, you know, when I look about the history of vaccination, I mean, original vaccines were taking pus from infected patients or from cows and injecting it directly into people. So when you think about how these things have progressed from essentially taking ill patients' own you know, fluids and injecting non-ill patients with that to taking just the smallest portion of the virus that, you know, you can get an immune response to and just giving that to patients. I mean, it's a world of difference. And that's part of the reason why they've been able to move so quickly in terms of developing it. So I mean, I'm super excited about it. And I couldn't be happier so far with the results in terms of how things are going.
Wow. Thank you. Thank you. So I wanted to shift a little bit and ask, so, you know, we can sort of feel and see our country starting to open up. Maybe even time seems faster than maybe we're comfortable with. One of the questions that came up, is it safe to unmask if you're fully vaccinated? When indoors, it was a question, but you can also apply it in any setting. So for yourselves, your family, or your patients, like each of you, what is your recommended strategy for those who are vaccinated versus those who are not, as we see this country rapidly opening up?
So with the unmasked, those being allowed to, you know, take your mask off if you've been vaccinated, you know, that doesn't necessarily apply to obviously like healthcare facilities and certain, you know, state mandated, you know, regulations with retail stores and things of that nature. So, you know, the wearing of the mask will still, you know, apply. You know, for example, like with my family, if we're out and, you know, eating, you know, my husband and I are both, you know, vaccinated, but, you know, for the most part in large public settings, we still wear a mask. You know, granted, for those that are vaccinated, transmission, it's a low risk for, you know, spreading disease or even getting, you know, reinfected, but we don't really control all those around us. And it's very simple just to, you know, to just keep your mask on for now as we continue to watch the numbers drop. Yeah, I don't know how everyone else feels about it.
Yeah, personally, you know, I've been trying to follow the CDC guidelines, you know, insofar as, you know, I'm not necessarily looking to the day-to-day data. So, you know, I trust the government when they put out these guidelines. I will say, you know, certainly with any patient interactions, so hospital-based or office-based, I've been wearing the masks. And, you know, part of that is just what Dr. McGugins-Hill said, which is you don't know what's going on with the other patients, with the other people around you. So, you know, we're dealing with immunocompromised patients, we're dealing with patients who can't get the vaccine for whatever reason, or people who've just gotten over COVID, that sort of a thing. So I've definitely been doing that. I have, you know, doctors tend to be a little bit more conservative, I think, than most. So I have been wearing my mask, you know, when I go out, you know, and certainly in indoor settings. And I've been encouraging my kids too, because, you know, I have to say this past year, nobody in my household has gotten sick at all. So it's been really nice not to catch these colds and all of that stuff. So, you know, I think it's been helpful from that standpoint also, but I'm always paying attention to what they say and, you know, willing to move the goalposts if the data suggests that.
So if I'm with family or friends that I know are vaccinated, at least the ones who can be, you know, based on the criteria, obviously the younger kids still can't be, and we're indoors, I have no problem having everyone not wear a mask. If it's a restaurant where, you know, I don't necessarily know everyone, and at the same time, the restaurant may be requiring mask wearing anyway, at least not you know, while you're not eating, then yeah, I'll wear the mask when I walk in, when I use the bathroom, take it off if I'm dining. And I feel comfortable dining indoors with friends who I know are vaccinated, and not having to worry about like putting a mask back on between bites or something like that, or when we're done eating, and putting it on when you get up to, you know, move around the restaurant or, you know, leave. Outdoors, I feel like if you're fully vaccinated, you pretty much feel very safe if you're outdoors doing almost anything at this point. I think as the weather gets better, if you're fully vaccinated, you can feel, at least I would feel comfortable returning to normal essentially for outdoor activities, whether that's outdoor dining, outdoor hiking, outdoor gatherings, whatnot. They are, you know, they've proven their effectiveness to me, and that it makes me feel comfortable to say that even if I'm someplace where I don't necessarily know who everyone is or what their status is in terms of vaccination, I would feel comfortable not having masks on if I'm outdoors. Again, like was just mentioned before, if you're immune compromised and you're fully vaccinated, you may want to still take extra precautions even under those kinds of circumstances. But if you're not, and it's outdoors and you're fully vaccinated, I think that's where life can really return, in my opinion, to normal.
Simon, and someone has got their second vaccination, is it 2 weeks they need to wait before they can really open up? What's the time interval?
Right, so fully vaccinated for the Pfizer or Moderna vaccine means 2 weeks after your second dose, and fully vaccinated for the JNJ is 2 weeks after the one dose.
Okay, great. So for me, so in the hospital setting and in my office, I'm definitely wearing my mask. And generally in crowded places, going in stores, I'm pretty conservative too. I'm still wearing my mask. But outdoor stuff, when I golf, when I work out, when I'm outside, I don't wear a mask anymore. I don't feel like that's necessary in the outdoor setting. But indoor settings, I'm more cautious. Now, my family's out here. My daughter and granddaughter just arrived. Everybody's gotten a vaccine except for my granddaughter. So in house with my family, none of us now for the first time are not wearing a mask. And we're having a blast with that. So I think as has been spoken by the panelists, you still need to be somewhat wise and selective, but definitely in the setting of people who've all gotten the vaccine, you should feel fairly comfortable indoors. So next question is the vaccine safe for pregnant women or women thinking about getting pregnant? At what stage of pregnancy should they be vaccinated?
So, I mean, that's another area where obviously, you know, the data is still, you know, lacking, but more and more research is being done. And actually, it has been deemed to be safe. I mean, I have a significant patient population of pregnant ladies that have been vaccinated and throughout all stages of the pregnancy. And they actually are being encouraged to just report their progress, not just adverse events, but just how they're doing in general, to the vaccine registry so that we can, get more numbers to basically validate the safety of this vaccine. But as it stands right now, the data is limited, but it is felt to be safe.
Great. How do, there's a question that's come up, a couple of questions related to children, pediatrics, kids under 12. And this might be more a question for you, Simon, but Jennifer and Gaetan, if you guys have answers too, it'd be great. But the question is where does that stand as we go back to school? Will they be able to get vaccine? That's part one. And part two, what about babies? What is their risk? And even if we're vaccinated or not, do we need to wear a mask around infants? How does that work?
Sure, I can try to answer that. So very likely over the summer, the Pfizer vaccine will be authorized for use in younger children, meaning 2 to 12, or I guess 2 to 11. Those studies are ongoing, they're sort of wrapping up. I think everyone expects the data to be good and for the vaccine to be authorized over the summer for those groups. This is my somewhat personal opinion, I don't see the school districts mandating vaccination for K through 12. I can't imagine that would happen. University college education is different. It's a choice someone makes to go there, whereas K through 12 is a requirement. So I think the dynamics are a bit different in terms of trying to require a vaccine that's not even FDA approved, but is only emergency use authorized. Eventually, will that come? It might, but I doubt it'll be for this coming school year. But the vaccine probably will be authorized for emergency use in that population in the next few months. So parents will have the opportunity to vaccinate their children potentially before the school year starts. And for the under 2 population, I don't think we're going to get data on these vaccines. I doubt that, just like very many other vaccines, that it'll be something that's going to come anytime soon. The good news is that most very, very young children seem to really have absolutely no problem with this virus. And if everyone around them is vaccinated, that can be, then those children are going to be at very low risk of having to worry at all about COVID. So if the adults taking care of a young child are vaccinated, and common sense precautions are being taken, I think that wearing masks around your young child, if you're fully vaccinated, is not necessary.
Thank you. There's a question the three of you can answer. It's a 2-part. Is should we be concerned about virus mutating? What does that mean? Is there something that's going to make the vaccine less effective? Along with that, there's a specific question: are there virus mutations that put people of color, Blacks or Latino or other at greater risk? They attack, I guess, based on their ethnicity or race. Those are 2 questions. Can you guys answer that for us?
So, with viruses themselves, they naturally mutate. Over time, viruses will mutate, and the best defense for that is for people to get vaccinated, because then what you're doing is you're minimizing infection rates, and hence you're minimizing the virus mutating within more and more infected people. So, the best defense for that would be to protect yourself, protect those around you by getting vaccinated. The idea thus far, the research shows that the vaccines are protected, against the variants, but again, it's limited right now. So more to come on that for sure. I'm not sure, Simon, if you have more on that.
So in all the real world studies that have looked at how these vaccines are doing against the different variants that are out there, and Dr. McGugins-Hill is absolutely correct. Viruses mutate, that's what they do. But all the studies that have looked at these mutant viruses, these variants of the original coronavirus, show that these vaccines are still They may be a little bit less effective at completely preventing someone from getting sick, but they're all still very effective at keeping people from getting severely ill or hospitalized and dying. And so that's good news. This includes some recent, more preliminary results, but looking at the variant that's now developed in India has actually spread to the UK. And so far, at least in the UK, it looks like the AstraZeneca vaccine that most people there have received is doing a good job at preventing severe illness in the population. So that's all very encouraging. It speaks to how impressive the technology is. The virus will continue to mutate. In the future, we may need a different version of the vaccine. That's all I think still remains to be seen. There were some questions about, will we need boosters? Will it be an annual? I don't think anyone knows for sure yet. I think everyone's expecting that boosters will be something that'll happen for the next year or two. Whether it'll be an annual booster or not, I think it's too soon to say. Too many variables there. But again, the virus is mutating, but the vaccines are still doing a great job at protecting people from the most severe complications from the illness.
Great. Gaetan.
Yeah, and just to sort of reiterate there, preventing somebody from even catching the virus, reduces the mutation rate, just because, every time this virus starts spreading in somebody, you just see millions and millions of copies, all of which are an opportunity for a mutation to happen. But even the people who get vaccinated, who have sort of breakthrough or asymptomatic infections, even their viral loads are significantly lower than patients who have asymptomatic infections and aren't vaccinated. So, vaccines are definitely the way to help both prevent these mutations from kind of expanding, but also to prevent the illnesses, because they seem to have a good cross reaction with these mutated variants that we see so far.
Great. So I think this will be our final question as we wrap. You guys have been awesome. Thank you so much for sharing your experience and your wisdom. But this is a practical question. How should the public proceed when they need to go to the hospital for non-COVID health matters? So for example, should I be concerned, Gaetan, if I'm coming in for a neuro procedure with this pandemic at this stage, or any other test for that matter, given what we went through in the last year? How should a patient consider if the doctor's saying you need to have this test and you're going to have to go to the hospital to have it, or go to a major medical facility to have it? What would you guys' advice be at this point?
Yeah, at this stage, things are so well controlled, thanks to the efforts of the ID docs, and, all the frontline doctors, and, the vaccine and that sort of a thing. And probably at least the last 6 months, they've been able to essentially isolate patients and identify patients who are, either symptomatic or asymptomatically, infected, such that you can keep these patients in one section, essentially away from everybody else. So all of the outpatient facilities, they have questionnaires for patients. Any inpatient who's coming in, gets screened for this. Any elective patients that we have that are going for tests or going for surgeries, are all getting screened in a way that, I have not seen a single person coming in for an elective thing where that was a concern at all. So I think, as long as the numbers stay low in the community and you're not overwhelming the healthcare system, that's going to be true moving forward.
Great.
Yeah, I totally agree. I mean, obviously, if someone is having some type of acute emergent medical crisis, obviously going to an emergency room setting, should be advised. And the current state of our pandemic definitely should not be prohibited. The protocols that have been put in place on the inpatient, elective, and outpatient setting have been great. We're over a year into this, so fortunately, we've learned a lot of do's and don'ts. And for me specifically on an outpatient side, the questionnaires, the pre-screening is extraordinarily involved. I mean, on average, a given patient probably will get called and asked the same battery of questions at least 3 times before they even pull in the parking lot. So, patients should feel very safe. And I've been at other practices for a variety of other reasons, and they, many have followed that same protocol. So patients should feel very comfortable, going to their medical visits and taking care of their medical conditions, because unfortunately that's what we saw right in the beginning, where there was a significant neglect of comorbid conditions because of the fear or inability to seek routine care. And that's something that we definitely want to discourage at this point in time, especially since it's not necessary, to ignore your medical care.
Simon, what do you say?
No, I completely agree with both Dr. Moise and Dr. McGugins-Hill. I think, at this point, like was already stated, the protocols in place are keeping healthcare facilities, outpatient very safe for people who need to have other kinds of care delivered, and they should not delay care because that does lead to poorer outcomes. And we saw that earlier in the pandemic when people come later than they otherwise might have been because they were afraid about visiting a healthcare facility. But that's, at this point in time, I would have no problem with family, friends referring them to whatever they might need to get done, wherever it might be, in or outpatient. It's very safe. And remember, at least in the state of New Jersey, probably over 80%, if not more, of patient-facing healthcare workers are vaccinated at this point.
So guys, thank you so much for being the panelists. You guys did awesome. I'm going to turn it back over to Chris.
Thank you, Dr. Williams. Thank you, all of the doctors, Dr. Moise, Dr. Williams, Dr. McGugins-Hill. You guys are fantastic. And thank you for your willingness and your commitment to the community. It's so great to see you all and see people that look like us and that work like us in such astounding and profound positions. Valley Hospital is really to be commended. Thank you also for Elizabeth Lucas for your support in terms of making this event work. Again, from CHARC, we want to make sure that if you have any questions, you can reach us at 201-487-3656. We will have opportunities to get vaccines as well. And I believe, Elizabeth, you also have some opportunities at Valley Hospital to make appointments. Maybe you can speak a little bit about that.
Yes, actually Valley has a vaccination center that's located in Paramus next to our Lucco Pavilion. The address is 599 Valley Health Plaza. They are taking walk-ins, but if you would like to make an appointment and you are not comfortable on the computer, you can certainly call me. I'll wait a moment and then give you my phone number. So the number is 201-291-6218. And I'd be happy to have someone in my office make the appointment for you. That's the Pfizer vaccine. We are also going to be starting to vaccinate people at the Garden State Plaza. We have a walk-in medical facility on the lower level down where Lord and Taylor used to be. So that's going to be starting as well.
Excellent. That's great. So again, this is the beginning of a partnership with Valley Hospital. We're looking to work together with them to serve the community. And we're delighted that everyone came. Spread the word of what you learned tonight. I hope that you took notes. Again, this was an outstanding event, and we're very happy to see that people came and heard the wonderful information. Thanks again to Valley Hospital as well.